The theory of evidence-based practice. Cornerstone of the evidence-based practice movement led by Dr. R.J. Cochrane, a British epidemiologist. In 1972, Cochrane published a landmark book, Effectiveness and Efficiency: Random Reflections on Health Services, that criticized the medical profession for not conducting rigorous reviews of research evidence. In 1980s, field of nursing supported efforts to apply research findings to practices. The process, called research utilization, uses some aspect of study in a manner unrelated to the intent of original research. As research is conducted over time, evidence accumulates about particular topic that can be used to varying degrees in clinical practice. Through research utilization, the nurse may then change his or her actions. EBP presented a major paradigm shift for healthcare education and nursing practice. Definition of EBP by Melnick 2003, a problem-solving approach to clinical decision-making that incorporates a search for the best and latest evidence, clinical expertise and assessment, and patient preference and values within the context of sharing. While Routledge and Grant 2002 define EBP as K that integrates best scientific evidence with clinical expertise, knowledge of pathophysiology, knowledge of psychosocial issues, and decision-making preference of patients. The goals of EBP. First is provide practicing nurse the evidence-based data to deliver effective care. Second, resolve problem in clinical settings. Third, achieve excellence in care delivery. Fourth, finally, reduce the variations in nursing care and assist with efficient and effective decision making. There are three key components of EBP. First, research evidence. Second, clinical expertise, judicious use. Third, patient's values and circumstances. First, research evidence. There are randomized control trials, laboratory experiments, clinical trials, epidemiologic research, outcome research, qualitative research, expert practice knowledge, inductive reasoning. This is the provide for the evidence from research. B. Clinical expertise, knowledge gained from practice over time, inductive reasoning. Third, patient values and circumstances, unique preference, concern, expectation, financial resources, and social supports.
Why promote evidence-based practice? Evidence-based practice saves time. The nurses no longer waste their time on activities that have no known benefit for patient. For example, measuring blood pressure non-invasively in children for every 6 hours. Only once a day is enough for normal patient, but multiple times for patient that need observation. Superior nursing skill. When incorporating evidence-based practice to our nurse education and clinical experience, it will develop nurses to have advanced critical thinking and decision-making skill, which will cause them to be better at adapting to different situations, utilize information, and work in interdisciplinary teams. Meet the expectation of informed public. Due to the growing amount of scientific background and research used and applied in clinical patient care, the goal of improved and consistent outcome fails to be met if the nurses did not practice evidence-based practice. Evidence-based practice enable healthcare organizations to reduce their expense. For example, outdated practice may have included supplies, equipment, or products that are no longer necessary for certain procedures or techniques. Evidence-based practice might prompt nurses to alter the method, even if the evidence contradicts what they have learned in school or what have been standard practice for decades. For example, using ice water to treat fever. It will not treat the patient but harm the patient. It has been changed to the lukewarm water because increased evaporation rate equal to increased heat loss. Evidence-based practice enables nurses to include patients in their care plan. This allows patients to have proactive role in their own healthcare since they can voice their concern, share their value and preference, and make suggestions on how they want to proceed. Nurses can stay updated about new medical protocol for patient care by searching for documents intervention that fits the characteristic of their patient, then nurse can increase their patient's chance for recovery. Evidence-based practice enable nurses to evaluate research so they understand the risk of effectiveness of a diagnostic test or treatment. This will reduce unnecessary diagnostic tests or treatment that may not be needed by patient as it was researched on and reinforced by the evidence which is the result of research. Example of evidence-based practice. IHI have developed bundles of measures designed to prevent VAP. CDC have made a guideline for infections, including central line associated bloodstream infection and catheter associated UTI. Prevention of ICU acquired delirium by using the awakening and breathing coordination, delirium monitoring and management, and early mobility bundles. Early mobilization of hospitalized patients can improve patient's functional status and also reduce the patient's hospital stay. Example of evidence resource.
Okay, now let's talk about importance of EBP to nursing profession. Actually, there are a lot of importance of EBP in nursing practice, but I'm just going to talk about 6 importance of EBP. Okay, first of all, EBP help to make sure that nursing practice remain relevant, to make sure that nursing care is up to date with the current situation of patients. EBD will make sure practice remain applicable to current patient populations, condition and technologies. From new EBP research, we will be able to question the current practice whether the practice still relevant based on patient's condition and technologies that have been developed recently. Second, EBP help generate new knowledge in nursing. For example, in pediatric department, when the baby is admitted due to jaundice, the baby will put under the phototherapy light. Before this, nurse need to turn them to make sure that the body part all exposed with the phototherapy light. But research shown that there's no difference between turn the baby or just let the baby lie in supine position. Research improve knowledge in nursing practice and make practice more applicable. Third, improve patient outcome and satisfaction. Nurses can increase their patient chance of recovery and reduce the amount of disability and suffering of people by giving the most current effective care. Fourth, as a guide in nursing practice, EBP help new specific nursing intervention for the care of patient. After that, provide highest quality of care. EBP research provide effective, proven rationale for nursing action. Every nursing action are taken based on EBP and has rationale behind it. Lastly, provide scientific research in nursing. From scientific research, it will help nurses to make well-founded decisions in clinical area. Also, EBP help in determine an effective course of action for care delivery. Next, my friends gonna present about it.
Now, I want to talk about barrier toward adoption evidence-based nursing practice in Malaysia. Firstly, the barrier is insufficient of knowledge about evidence-based practice among nurses. This is because of nurses having had no previous training in evidence-based practice, and also lack of clear guideline for doing research, and also affected by other problem also. And then nurses also have difficulty interpreting research report due to lack of understanding of some term that used in research article. Insufficient of time, one of the barrier to nurses to adopt evidence-based practice. This is caused by overwhelming patient workload, and these lead the nurses do not have time to read, research, or implement new ideas. The research report not readily accessible, especially in the internet. This is because of lack of internet to access for online information. Next, a study conducted by Lai, Teng, and Li 2010 in their study state that lack of good information technology support in the world one of the barriers to adopt evidence-based practice. For example, computer with no internet. From that, nurses unable to access online information, especially about evidence-based practice that related to the nursing care that give to the patient. Nurses also lack of commitment to improving and change their practice. This is because of nurses already influenced by other nurses, especially by a senior nurse, to practice the old way that do not have evidence-based practice. When nurses do not have commitment to change their practice, and this can affect the care that deliver to the patient. In addition, poor administrative support also one of the barriers to perform the evidence-based practice in nursing. This is caused by lack of incentive for nurses to pursue advanced education or engage in research. For example, if ward level manager do not support their subordinate to acknowledge evidence-based practice, evidence-based practice cannot be achieved. Other barriers including lack of awareness among nurses about evidence-based practice. This is because of nurses' lack of educational preparation, and they do not have motivation to search and apply the evidence-based, especially about nursing.
Strategies to promote evidence-based practice. In 2018, a few strategies that have been identified to promote evidence-based practice has been suggested through a research entitled Barriers Associated with Evidence-Based Practice Among Nurses in Low and Middle-Income Countries. This includes overcoming the institutional barriers such as lack of resources, lack of access to information at the workplace, inadequate staffing, and lack of support. According to Eisenberg 2011, providing nurses with access to the library and opportunities working with a computer may overcome the barriers due to lack of resources and access to information. Improving support will lead to better promotion of evidence-based practice, as suggested by Van Pettegel and Schaffer 2009. They stated the needs for nurse manager to provide the resources and the support for the work and celebrate success with recognition of unit staff. Overcoming the nurse-related barriers may improve nurses' leadership and clinical roles in terms of evidence-based practice integration in the wards. This could be achieved by integrating evidence-based practice into nursing curriculums or by providing continuous professional development opportunities for nurses. Implementation of mentorship program may enhance evidence-based practice as it allows nurses to refer to their mentor, who are much more experienced and skillful for any inquiries. Next, overcoming the individual barriers related to time, such as lack of time to read research findings, conduct research and implement new ideas into practice. Strategies include making sure that there is enough staffing and interdisciplinary collaboration to allow optimum utilization of evidence-based practice. Implementation of a virtual journal club to encourage discussion among nurses. To overcome interdisciplinary barriers such as lack of communication between academic and clinical practice environments and also teamwork, nurses and other healthcare professionals should become more supportive of each other by coordinating activities in a much better way in order to improve interprofessional collaboration.
In conclusion, evidence-based practice in nursing guarantees care interventions are based on data from research, which ensure that clinical practices are appropriate, safe, and of high quality. Nurses must therefore develop a culture of inquiry to support and maintain the process of evidence-based practices. Thank you.